All right. All right. Hello, everyone. Welcome to the 26th webinar of the month. And today's talk is abdominal lymphedema, diaphragmatic breathing, and a demonstration of self-MLD of the abdominal region. And we are glad to welcome our speaker, Holly Rodriguez from Kaiser Permanente. However, for some reason, didn't think it was important to send her a link until just a minute before we got started. So we might need a little time for her to get connected with us. And so what I'd like to do, first of all, is to introduce my team to you. And then after that, hopefully, Holly will be all set. Otherwise, I can get started with a demonstration of abdominal bandaging. So first, who we have up on deck is Alyssa Fiorito. She is our NLN Garment Program Manager. Thank you so much, Alyssa, for doing such a great job. And we also have Erin Sokolsky, who is our Marketing Manager, and Veronica Senares, who is our Social Media Manager, and Christy Blair, who always likes to make a nice grand finale entrance. Oh, and there is Holly Rodriguez. Holly, I was telling everybody how I just decided to wait until the very last minute to send you a link. That's why you're not on yet. But here you are, and we're so happy to have you. And then also below Holly is Christy Blair, who's our project manager. And then we also have Nicole Ballard, who is our membership manager, and Jennifer Williams, who is our continuing education manager. Thank you to my team for doing an amazing job. And that is Emily, Christie's young daughter. Hi, Emily. All right, so I am so excited, Holly, that you are actually here, and I'm so sorry that I did not send you the link. I don't know why. I thought I did it. I must have done it in my dreams. So
that's okay. Thank you. Happy to be here. Thank you for having me.
Yeah, we're so excited for your talk. And, forgive me, I don't remember your exact title. So I just said that you are Holly Rodriguez, PT from Kaiser Permanente in California. And please introduce yourself in terms of other credentials and such to the rest of the world.
Yes, I think you did a great job. I am a PT, I am a CLT-LANA certified, and I am at Kaiser Permanente, and I'm in Northern California. From Vacaville, if anybody knows where that's at, but it's kind of in between San Francisco and Sacramento.
Great. Well, thank you for that. And the floor is all yours, Holly. Take it away.
Okay, great. Let me share my screen. Thank you.
So while you're sharing your screen, just to let everybody know, we did have a change of plans in terms of who is our sponsor this evening. We originally had Wear Ease, but I made a mistake again with Wear Ease. And so that change is also my mistake. And so Wear Ease will actually be joining us on Monday after the exercise talk. And so today we are welcoming LNR USA. And they are generously giving away a whole Complex 2 sheet. So stick around for that. And you know what, actually, perhaps it might even be good to do this now, because I think that everybody's kind of like used to it already. If you would like to be entered into the drawing for a whole sheet of Complex 2, which is like really expensive, I think it's like $150 or something like that, please raise your hand now. And somebody from my team will put the names on the wheel. Now, I have to tell you, I think it is not 100% clear how to raise your hand. It is not by putting your name into the chat, and it is not by putting your name into the Q&A tab. It is by going next to your name and basically highlighting raise hand. And then what you'll see is basically a little yellow hand. If you go next to the attendees, you'll see, I believe that the attendees have the view of who is in the room. And if not, the panelists do at least. And we see the raised hand. It's a little yellow hand next to your name. So that is how we know that you are interested in entering the drawing. If your hand is not raised in that fashion, you will not be entered. And that's that. So with that, I'm going to give it back to Holly. She has her slides up. Holly, take it away.
Great, thank you. So my talk today is going to be on abdominal lymphedema. I will also be going over diaphragmatic breathing, self-manual lymphatic drainage of the abdomen, and also some exercises that can be done to help with abdominal lymphedema.
Excuse me, Holly, can I just ask, did you intend to not be seen? Because that's okay if that's not what you wanted, but we don't see your video in case.
Oh, goodness.
Yeah. So if you're going to share your video so we can see your face, that would be great. Otherwise, no big deal. We know what you look like.
How do I do, let's see, how do I share my video? Because I didn't mean to stop sharing.
Oh, no problem. Hold on one second. Don't do anything with your slides. I'm just going to basically go to,
can you turn it on for me?
Yeah, I can request it. And then you can just say, okay, Jeanette, I'd like to share my video. So I just did. And if you just see it, it'll be like a little notification that pops up. It says, Jeanette Zerker invited you to share your video. And then you just say, okay.
It's not coming up.
Okay, you know what? No worries. You know, we're going to just go off on your slides. And when you no longer need to share your slides, we'll put you back on video.
Okay, thank you.
Thank you so much.
All right, so I do have a little disclaimer. The information is for general knowledge and understanding, and please consult with your physician or healthcare provider prior to attempting anything that is presented. So first, I want to go over the most common causes of abdominal lymphedema. The most common cause I see is secondary lymphedema, which can be from oncology, lymphadenopathy secondary to malignancy, treatment or surgery, obesity or obesity-induced lymphedema, trauma or surgeries, or trauma or injuries like surgery or burns, and infection. Less commonly seen is primary lymphedema, which is where there's an intrinsic genetic abnormality of the lymphatic system and it may be inherited, such as lymphatic or chylous malformations. It's important to do a thorough chart review and include a differential diagnosis to rule out any other causes of swelling. For example, heart failure, advanced cancer, and other advanced diseases such as liver kidney disease, ascites, extrinsic or venous compression, like including vena cava obstruction, DVT, or hypoalbuminemia, which can all cause some sort of abdominal swelling. So looking at the signs and symptoms of abdominal lymphedema, we may see dermal edema, just that initial light swelling in the earlier stages. Swelling is going to be asymmetrical, so one side worse than the other. You may see a pitting edema, which is in this photo here, seeing if you press in, it's leaving an indent. Patients may have subjective complaints of fullness, bloating, or heaviness. We may start to see some hyperkeratosis where the skin becomes scaly and thickens. We may see epidermal papillomatosis and hyperplasia, telangiectasia, spider veins or dilated blood vessels, dermal vessels with a thickened wall, thickened upper dermis with fibrous collagen, lymphangiomas, which are little small blisters and bumps that can develop on the skin. And then we may also see lymphorrhea, which is where there's lymphatic fluid leaking from the skin. And so I like these photos. I think they do a nice job of just showing where the general lymphatic vessels lie on our body. So first on the left, it's showing where the lymph nodes are and the vessels. And then we have our vessels, which are mostly in our limbs. Those long vessels. Our nodes are more centralized and part of the deeper lymphatic system that will feed into trunks and then eventually into the ducts. In the limbs, you can see that the vessels are moving the fluid from the limbs into those deeper vessels. And it's important to know where those deeper lymphatics are, because those areas will need to be decongested first, meaning that we need to treat the trunk first, whether it's with manual lymphatic drainage or with exercises prior to moving out into the periphery. And then I chose the photo on the right because it has a lot of good things in it that I wanted to share. So you can see at the base of this here, there's that cisterna chyli, and that's at the L2 level, and it's a little dilated lymphatic vessel. It's the abdominal origin of the thoracic duct, which crosses the aortic hiatus at T12. So as it just comes up, and that becomes that deepest, the largest lymphatic vessel in our body, which is draining 3/4 of our body, the whole left side and the right lower part of our body with that thoracic duct. And then shown up at the top up here, we also have our right lymphatic duct, which is draining that 1/4 of the body, so that right upper quadrant and the right head. So it's also worth noting here. This is the real reason why I chose this photo. Is this picture contains the diaphragm, and so it's a double dome shaped muscle. It sits at the base of our lungs, and you can see how the lymphatics move through that diaphragm muscle. And the vagus nerve also runs through there. It's not shown in this picture, but I thought it was also worth noting that it will also run through that opening of the diaphragm. And it's the largest nerve in our body, and it connects the brain to our GI system. It has a major role in the continuous feedback loop between our brain and to our gut. The diaphragm is activated when we breathe slowly and deeply, and this stimulates the vagus nerve to turn on our parasympathetic nervous system, which is the opposite of the fight or flight, right? So it's that calming system, and so it's resulting in a relaxation response. Diaphragmatic breathing is important because there's a lot of lymph nodes in that area. Breath into the pelvis helps to stimulate those lymph nodes, which creates a muscle pump to help move that deeper lymphatic fluid. And so I wanted to have you practice. Let me see if I can stop sharing and then pull my video back on, just so we can practice this together. So let me see.
I'm gonna try to invite you again.
Okay.
Yeah, let me see. A little bit of a glitch. We saw you in the beginning. So let's see.
It's just not allowing. Oh, there I am.
You are. All right. Let me put my video.
Oh, goodness. Oh, computers. We got to love them, but don't.
Well, you know what I have to say is that I totally take full responsibility for this, because, you know, most often everybody's like so well prepared, and they're on like early. They have to get like into that frame of mind, and I just said, you know what, Holly, I'm going to give you a challenge. I'm going to give you not that time. I'm just going to throw you right in there, and you're handling it so graciously. So thank you so much for that.
Oh, thank you. Now I lost my slides, but
we just lost your video. Let's see.
And so apparently I can't show my video at the same time as my slides. So that seems to be what the problem is.
Right. Okay. Well, then why don't we show the video first, and then we'll see you afterwards.
Okay. Is my slide sharing again?
Yes.
Okay, great. So I'll see you shortly.
Yes. You do have to reshare your slides.
It's goodness. I apologize. It's so.
All good. All good. All good.
Okay.
Well, you know what? Since we have the next thing that shows up, like if we're able to share your video, then that's what we'll go with. But if we're able to like see your video, then we'll go with that. But go ahead and give a screen share a try with the up arrow in the center at the bottom with the slew of icons that you see, and just give it another try. You know what? You know what, Holly? I'm going to give you a moment to just try to get that up. Oh, and there it is. Okay. Excellent.
I don't know if it's my connection or what. I thank you everybody for bearing with me. I apologize.
It is all good. All good. Okay. Go ahead and
I'll continue. So
yeah.
So one of the main things that I wanted to share with you today is the importance of diaphragmatic breathing or deep breathing. So I'll give you the basics, and then we can practice it. So you want to be lying, I find it easiest to start lying down. So you can do this on a bed or on the floor with the knees bent and the feet are flat. And then you can put your hand on your abdomen if you like. I also find you can put one hand on your chest and one hand on your belly and just trying to breathe into the belly and trying to keep the chest silent. So what you want to do with the diaphragmatic breathing, first you'll exhale and let your belly sink down towards the floor or bed, the belly button towards the spine. And then you're wanting to inhale and focus on expanding your belly instead of the chest. So I like to tell my patients, smell the roses, and that's allowing the belly to fill, and then slowly blowing out the candles. So go ahead and breathe in and blow out. We'll do that one more time because I think we all need it just to calm down. Is breathing in through the nose, letting the belly expand, and then blow it out. If you add a hand onto your belly, that just draws some attention to that area and allows you to try to focus more. So if you're having trouble figuring out like, oh, am I doing this right? Just put your hand on your belly if you feel comfortable with that. And then when you breathe in, try to breathe into where your hand is. And then blow out. So if this can be done in a reclined position, if lying flat isn't comfortable, once you have practiced it and you feel pretty good about it, you can then try it in different positions. You can do it in sitting or standing as needed. And so I also wanted to share with you a bit about manual lymphatic drainage. So for those that may not know, it's a light skin stretching type of massage that helps promote the movement of lymphatic fluid out of a swollen area. It increases lymph production, increases lymphangioactivity, reduces pain, increases urine output, increases generalized relaxation, and improves pliability of the skin. So it's all those really great, parasympathetic stimulation. And so there are some things that we need to think about when we're talking about wanting to do manual lymphatic drainage. There are some general contraindications where we can't do it. It's just not safe for us to do with a patient or have a patient to learn how to do it themselves. So the absolute contraindications would be cardiac edema, acute infection of any kind, renal failure, relative severity with doctor supervision, an acute DVT, bronchitis, asthma, or hypertension. Relative contraindication would be malignant lymphedema. We could do with a doctor supervision when it's more of a palliative case. And then specific with things that we need to think about for doing MLD on the abdomen, there are some general contraindications of menstruation or sensitivity of cycle, pregnancy. We want to avoid over the abdomen, abdominal aortic aneurysm, or a current history of a surgical repair, diverticulitis, diverticulosis of small and large intestines, recent abdominal surgery. You want to clear with the surgeon when that would be okay to start to resume or start in general. Inflammatory bowel, like Crohn's disease or ulcerative colitis, severe arteriosclerosis, acute DVT, in the pelvic area, a presence of a clot-preventing device such as an IVC filter, unexplained pain, irradiation of the abdominal region, or a presence of a feeding tube. So I decided to include the anatomical watersheds and anastomoses. I know this is a little out there for some, but I think it really helps to highlight why we do MLD in a certain sequence. And so the black lines here, those thicker, bold black lines, are the watersheds. So we have this mid-sagittal line that is that number 1 that's on this vertical going down the body. And then we have the transverse, which is that horizontal line that's at that abdomen level. And then we also have a clavicular line, which is just at the collarbones, just by the neck. And then on the back, we have the spine of the scapula and the chaps. And then in the gold area, we can see that there's some areas where that those lymphatic vessels could cross. So usually the lymphatic vessels would like to stay within that corresponding quadrant, and that limb, if it's the arm, let's say it's the left arm and the left chest, front and back, from that belly button to the collarbone, breastbone to the spine, that whole area will drain to those lymph nodes in that armpit. And I'll do the same thing on the right side. But below the belly button, that leg, half the genitals, and that lower abdomen are going to drain to those groin lymph nodes. And so we can use those anastomoses, the gold areas, to try to help move fluid from an area that may be overloaded to an area that might be able to help take on some of that fluid. And so we have one that goes from the armpit to armpit, which is interaxillary. We have interinguinal, which is between each of at the groin. And we also have an axilloinguinal from the armpit to the groin. And so I will give you a demonstration when I can turn my camera back on, but I usually recommend starting with 5 to 10 repetitions of each. Start with a short neck sequence that just stimulates some of those deeper vessels. There's my favorite diaphragmatic breathing. We can add additional optional hand placement. Sometimes if patients are really good with their breathing, I'll have them start moving their hand to other areas. So, just up a little on their abdomen on the left, and then down into the lower by the groin, and then back up, and then in the middle, and then we can do the same thing on the right. So just really stimulating those deepest lymphatic vessels just to try to get that fluid moving. So then when we need to move more fluid to those areas, that has a place for that fluid to go. And then, so this is looking at if it's a one-sided lymphedema. So we can either have that just like on the left side in the lower groin. If that were the case, then we could bring that. We can use that axilloinguinal anastomosis to help move the fluid. So we can stimulate those armpit nodes at the axilla by doing a little pumping. And I'll do this, I promise, with video in just a bit. I think of it like I'm waking up those lymph nodes, and then I can start to bring that fluid up towards the armpit just to try to help offload that lower quadrant. And it would be the opposite pretty much if it was like someone had lymph nodes removed at their armpit, and we don't want to bring more fluid to that area because there's some congestion. We can stimulate the groin lymph nodes on that same side and stimulate those. And once we've done that 5 to 10 times, then we can start to bring the fluid down to that lower quadrant to try to help offload that upper quadrant. And if it was in the same, if it was at the groin, let's say there was someone, if a patient had a sarcoma or a cervical cancer, and they have some backup at that the left groin, and there's been no lymph nodes or any disruption of the lymphatics on the other side, then we can stimulate the lymph nodes on the right side and kind of wake those up nice and slow. This is a very rhythmic technique. We're getting that skin stretch, and then we can bring the fluid over from the left over to the right. And then once we've used all the you know, or anastomoses that we can, so we're not overloading any other areas. Then we finish with deep breathing. So we're just kind of finishing that loop. And so it's important to make sure that we're thinking about where there might have been some lymph nodes removed. If there's any scars, we can work around those areas. And so I see this more so in my patients who have been through cancer surgery and treatment, but we can also see it in any primary lymphodemas too. And so it's a little bit of a different sequence when we have both sides that are involved. I mean, we're going to see one side that's always a little worse than the other, but if we're seeing swelling at the lower abdomen, those groin lymph nodes on each side are pretty congested and they can't keep up with the demand. So we're seeing this backup of the fluid. And so we would start with the neck again. And just a precautionary, don't do if there's a history of stroke, arterial plaques, carotid issues, I would just skip it. And then I would start with diaphragmatic breathing. Again, you can do those optional hand placements. And then in the example I was just describing, if the groin area were congested, we can stimulate at the axilla and get those lymph nodes prepared. So then we can utilize that axilloinguinal pathway, that anastomosis, to try to help move that fluid up to help move that, just to offload it. And then if it were the same, let's say that if a patient who has breast cancer on both sides, and so the lymph nodes at each of the armpits, there's been disruption, and so if my patient has some swelling that's in the chest and into that upper abdomen, I can't really move that fluid, which would want to go to that armpit. And so I could stimulate the groin on each side, and then I can bring that fluid down towards the groin, going from the armpit down to the groin to offload that area. And then I would finish with the deep breathing. And again, things to be watching for: lymph nodes have been removed, any scarring, any radiation scarring too. So we might see this more in a lymphatic overload. Maybe someone has like obesity related lymphedema. We could also see in primary, or again, if bilateral lymph nodes have been removed on each side. And so lastly, what I wanted to go over with you, because I think that exercises are very important to be doing to just help to activate our muscle pump, right? We need that active muscle pump, that contraction, relaxation, to try to help pump that lymphatic fluid through the system. And so here I have some remedial exercises, but I find them quite effective. So there's our deep breathing again. So I would generally do these exercises, taking 3 seconds to do each direction. It should always be pain-free. And then I would do 5 repetitions of each twice a day. You could do more too, but again, always check with your doctor. But so just as with lymphatic drainage, we need to stimulate those deeper lymphatic vessels, and so the deeper ones, and so we start with the deep breathing, and then after we've done that 5 times, then we can rotate the neck. So again, taking 3 seconds to do a repetition, going one direction, and then 3 seconds back to the other side. And then after you've done that, you can do some shoulder circles backwards. So just bringing the shoulders up towards the ears, backwards, down and around. Taking 3 seconds to do a repetition. Remembering to continue to breathe. Just don't hold your breath. And then the next one I like is an arm swing. So just bringing one arm up, and again, pain-free range. 3 seconds, and then we swing the other arm up. And then after this, we can pinch and squeeze the shoulder blades down and back. So a little scapular retraction and relax. It's really good if you sit all day. Opens up the chest, gets those deeper lymphatic vessels flowing. Once we've done that one, we can move down to the lower quadrant. So doing a marching, so lifting a knee up, taking 3 seconds to lift, and then 3 seconds to place back down. So we go nice and slow to keep up with the lymphatic vessels. And then if we were alternating, then I would do 5 on one side, or 10 total. You can 1 on each side at a time, and you could do 10 total, or you could do 5 on one side and 5 on the other. This next one is just pinching and squeezing the buttocks together, a glute squeeze, hold for count of 3, and relax for a count of 3. And then after that one, it's just letting the knees fall apart. So a little hip abduction, and then bringing the knees back in. 3 seconds out. 3 seconds in. And then I would finish with some deep breathing. All right, so let me stop sharing and then I'll rejoin you all on video. Hopefully.
We're just waiting for it to connect. So I'm just going to, let's see. I just want to fill in the blanks a little bit while we're getting your video on. But that was a great presentation. And there you are. Allow me to spotlight you. And now you can go ahead. Thank you so much, Holly.
Okay. Yeah, of course. Thank you. So since I was just talking about the deep breathing, so they're just nice and slow, really just opening up the chest, getting things moving, circles. And then after we've done that one, we're just alternating arm swings. All pain-free. And then pinching and squeezing the shoulder blades back. It's my favorite exercise. If you feel comfortable, you can do them with me. And then the others were working on the lower area, so adding a little marching. So I shouldn't have one black. And then you can alternate up. Yeah. And then squeezing the shoulder blades together, holding for a count of 3, and relax. And then bringing the knees apart and back in, however your hands are comfortable. I'm shortening them just a little bit just to get through everything. And then finishing with that deep breathing. So with the deep breathing, I mentioned a couple hand placements. So you can just if you're lying down on your back, or even just sitting right how you are, feet are planted, knees are bent, And when you're breathing in, you're breathing into the hands. So the belly expands, and then slowly blow out the candles. And the belly sinks in. If you feel comfortable, you can close your eyes and do it, and that allows you to focus more on the breath. If you find that you're breathing more from your chest, you can put a hand on your chest and one on the belly and try to keep this silent and try to breathe into the belly. So it's just a reminder here to not kick on the neck muscles to help. All right. Well, I definitely feel more calm with that now. I do want to go over the self-manual lymphatic drainage with you all. I know I just had my slides up and you couldn't see me, and I apologize again about that. Apparently my system doesn't like to be on with both at the same time. So, so with the unilateral, so that just means one side where there's swelling. So I will often, I'm trying to get my camera in a way so you can see me better. Let's see. So maybe I've had a tumor that was here on this side, and they took some lymph nodes and I had some radiation. But on the same side, I have no problems. I haven't had breast cancer lymph nodes removed here, and I didn't need to take anything on the other side. And so what I would do first is the neck sequence, and it's a short neck. So I like to cross, and then I just am going back and around. So again, you wouldn't do this if you had any issues with any carotid sinuses or carotid issues, stroke. I would just skip it. And you can do that 5 to 10 times. So nice and slow. I'm just getting enough skin stretch to get that snap back of the skin when I'm doing that. I don't want to be hard or putting so much pressure that I'm causing redness or irritation. I also don't want to go too light where we're not getting the skin stretch. Those vessels need stretch in order to allow fluid to get into it so it can get processed. So let's start with the neck, skip if you need to. And then we would do our deep breathing. And I mentioned an additional hand placement if you wanted to try. I learned it in my lymphedema training. And so we just start with the hand in the middle of your body over the belly button, and then breathing in and out. And then from there, you can go to the upper part of the belly and out. And then down to the lower part and breathe. You're really trying to breathe into the hand. And bring it back up. And back to the center. And then we can do the other side. Up. And then lastly, so it's a nine hand placement with that one. You shouldn't feel dizzy or lightheaded. You know, take a break stop and then just try to breathe normally how you would, and then you can try it again. You can always, reach out to your doctor for referral to PT if needed, if you need some additional help with that. So then once we've done the neck and the breathing, so again, if I'm going to my one side, I've had cancer over here, lymph nodes removed, I can have two places. So those black dark lines that were in the bold lines that were in that anastomosis and watershed, we can just cross one of those. So I can bring fluid over, or I can bring it up on the same side. So I can go to the groin on the side that doesn't have swelling or lymph node involvement, and I can go up and in. I think it's kind of easy to, when I tell my patients to bring the fluid, bring it up and in towards their heart. And I'm doing a 3-second hold and release. I want the snap back of the skin, so I'm fully releasing. I'm not just pushing up and then pushing it back down. I want up and in. So again, I kind of think of it like I'm waking up these lymph nodes on this side. And then once I've done that 5 to 10 times, then I can bring the fluid over from my involved side over to the uninvolved. So sometimes if people have a larger belly, we can use 2 hands. I'm just kind of pushing over and release. And then I move, lift up and then over. So I'm just like walking my hands to the side that can take the fluid. I don't want to bring it to this side where I've had lymph node involvement, where lymph nodes removed or lymphedema. We need to, I think of it like a big red X. So I'm bringing it to other areas that can help. So I'm walking over. It's a nice rhythmic stroke. You can do one hand if that's easier. Over. You can go with the contour of your belly. Or if it's too hard to reach, you can switch hands to finish it. And then once I've done that 5 to 10 times, my other option would be to go up to the armpit to use that axilla-inguinal anastomosis. So then I can go into the armpit and I can go up and in. You can do this reclined, supine with your knees bent or lying on your back in bed. You just need to be comfortable. You need to be able to get in and out of the position safely. And then once I've done that, then I can bring the fluid up. So however it's comfortable, again, you can kind of use 2 hands. You can kind of like scoop to try to help bring it up. If it's hard to reach, sometimes it's easier for people to use the back of their hand if they can't fully come up with the other hand. So we're just crossing that horizontal, that watershed line here to bring it up to the armpit to offload my congested area. And then if I had, let's say, lymph nodes removed for breast cancer, I'll do the other side maybe. And so I have some swelling in my breast and then some in my upper part of my abdomen. And I haven't had any lymph nodes removed on the other side or down at the groin on the same side. I would do my neck again, the breathing, and then I can go armpit down to groin. So I would want to, again, kind of wake up those groin lymph nodes. And then I can bring the fluid kind of down, getting that nice skin stretch. You can kind of bring it over and bring it down to the groin lymph nodes. I find it just is easier to go that way. If it was above, it sometimes is nice to come across, but for specifically the abdomen, since it's you know, a little bit lower, it's just naturally easy to bring it to the groins. And then if we've had both sides that have been involved, maybe I had prostate cancer, and you know, they had to take some lymph nodes from both sides, and so you know, my lower abdomen is congested. And maybe some backup of fluid into the genitals too. So this, you know, needs some help. So we would start again doing the neck. And once you've done that, the deep breathing. And then we can come up. We can bring the fluid up. We can't bring it over because this side is also congested. So we have a good option to wake up the armpit nodes. And then we can bring it up. And then I would do the same thing on the other side. Kind of in towards the heart, getting those armpit, the axillary lymph nodes. And then bringing it up. And then it would be the same if I had had breast cancer on both sides or lymph nodes removed, or maybe I have primary lymphedema and you know, maybe Milroy's or you know, something where I have involvement on both sides. So my option would be down if those areas were patent. So again, the neck, the breathing, and then I can do the groin. And then I would go opposite, bringing it down to help offload the area that needed help. Okay. So those are the main things that I wanted to share with you today. I look forward to your questions.
Thank you so much, Holly. We really appreciate that. It's now a good time for me to insert our disclaimers because I always forget in the beginning and I always remember at the end of the speaker's talk. Although we love Holly and everything that she shared, and it's very good information, it is definitely not to replace any of the professional care that you should be receiving from your healthcare team. Basically, all of these things are just meant to be inspiration so that you can take your self-care tasks to the next level. And again, it does not replace the interventions from your lymphedema specialist, from your doctor, nursing, and so forth and so on. Additionally, the other disclaimer is such that even though we absolutely love LNR USA and all their products, we do not necessarily endorse their products. They are products that have been created for specific uses of treating lymphedema. But it is for you and your healthcare team to decide which ones are appropriate for you. And let's see, any other disclaimer? I think that's it for now. Okay, so let me ask you some of the questions, and then I'd like to actually demonstrate just a quick abdominal bandaging just before we get started with LNR. But the questions for you, Holly, one is from Fenton. He wants to know if we can have access to copies of the diagrams that you included in your presentation today. Would you be willing to share that so that we can then put it up on the NLN website?
Sure, that's fine.
Okay, great. Thank you so much. And then he is also asking, is there a Peloton for lymphos? Let's see, for lymphos, style exercises. Let me read this verbatim and you tell me if this is good. Okay, is there a Peloton, parentheses, for lymphos, style exercises, available with a groovy lymph soundtrack, as I am a visual exerciser myself, love the visuals, always happy face.
Yeah, I do not have a Peloton. I haven't seen anything like that, but Fenton, if that is a passion of yours, I'm sure they would welcome that. And I think our lymphedema community would also really love that.
Indeed.
I think some general, I haven't seen anything like that. I don't know if you have, Jeanette.
I don't have a Peloton either. I've only biked on a Peloton once, and I really can't speak much of it. I believe that all we need is our body and gravity, and we can do just about anything. So, okay, so hope that answers your question, Benton. Alice asked, can the exercises that you showed be warm up, or is there like a more advanced routine available?
Oh, of course. I think that these are just a really gentle way to help, an effective way to help activate your lymphatic pump. These are just to stimulate in a way, just to try to get that pump, that stretch, good posture. Of course, I think that you can do any activity as long as it's safe for you. If you're needing some more formal guidance, I would ask your doctor for a referral to physical therapy so they can tailor a specific program for you. This is just meant to demonstrate some general information. And I do have patients that find those to be quite effective, even though they don't think they're anything. They're like, they're so basic, but they truly can be quite helpful. And I think it is important to do what you love to do with your activity. Just find ways that you can get some guidance if you love to play tennis, but maybe, you have some lymphedema, like, work with a therapist to come up with strategies to help you keep your lymphedema best under control and managed, like maybe you need some specific garments when you're playing, or even, something during the day. But, they can help you to develop a safe, effective program to try to help you get to the goals that you would like.
Thank you. Yeah, indeed, right? I mean, even with manual lymphatic drainage, it's very light. And when you teach it or show it to somebody who's not really involved in the lymphedema world, they really question the efficacy of it. They're like, you're not doing anything, but actually we are. We're doing so much, and sometimes less is more. And sometimes, like, when it becomes too complicated or too complex, it's not what's needed, right? So anyway, great point. Okay, so Alice asked, if you, the general you, have only left leg lymphedema from ovarian cancer with lymph nodes removed, is there a need to do this abdominal sequence? Or
absolutely. Yeah. Well, yes, I think when we're talking about the lower quadrant from the belly button below, and if it's just in the leg, the nodes on that side are also going to be draining the genitals and that lower abdomen. And so we just really want to make sure that we've decongested and cleared those deeper lymphatic vessels first. And so then the leg actually has a place to go. I kind of use the analogy often as lymphedema is like a traffic jam. Like, we have to, if you're on the freeway, and for me, I'll say, like, I'm trying to get from my foot is San Francisco, I'm trying to get up to Sacramento, like, I have to clear, I'm stuck in traffic on the freeway. I have to move all that first to try to give the leg a place to go into so it can get processed in those deeper vessels. So I think it's important, and it should always be, the trunk should always be involved.
Yeah, thank you. And just to highlight, the benefits include not only working on creating a powerful central suction effect on the lymphatic system, but also on the venous system, because whenever you encourage venous return from the lower extremities, you actually have less lymphatic burden in your legs, which will then have a ripple effect in terms of having less lymphatic burden in the lower abdominal genital region as well. So, so everything is connected, and so definitely. Let's see. Alice also asked, how do you incorporate this with MLD from the other day? And the other day is probably what I showed in terms of manual lymphatic drainage for the legs. So basically, just to answer the question, it's abdominal lymphedema. I'm sorry, abdominal MLD is such that ideally, if you have no contraindications, and again, you'll clear that with your healthcare team, it's incorporated with almost every lymphatic drainage sequence, whether you have head and neck involvement, arm involvement, genital involvement, chest involvement, or leg involvement. For the same reasons that we just discussed. Basically, you'll create this very strong, powerful central wicking effect, right? And so it prepares the body to be more effective in overall drainage. So, as Holly kind of discussed, right? Let's just say for you, Alice, you said it's your left leg. By doing your left leg sequence, right? If you were to not prepare the central portion, the drainage portion by the neck, then it's just going to be a little bit more slow in terms of the uptake, right? And this is how this is kind of like how I kind of explain it as well. I use the traffic analogy a lot, and imagine that you have a single road, and you basically have some cars on the road, and then you have a traffic jam far back, right? Which is like comparable to what's in your left leg. Now, wouldn't it be nice if you can tell all the cars in that left leg, this part of the road, to just go ahead and speed on by if the road was completely cleared, right? And that's what you're kind of doing. You're just making as much space as possible so that the traffic down in your left leg will have room to, drain into its final destination further up in the venous angles. You can totally, do it where, you just do the leg, but you run the challenge of where, as Holly had mentioned, below the belly button, that is where the lymphatic compromise starts. So you can drain all that fluid from your left leg into your lower abdomen, but it's not going to necessarily know to continue on up into the armpit because it doesn't normally go that way. So you need to basically kind of help it out by creating a lot of space, in the upper parts of the lymphatic system, which includes the neck, the abdominal region, where it is the deeper lymphatic system where it normally does go. And so, so that's the rationale. Do you have anything to add, Holly?
No, I think that's great. I just love this because we don't get to interact with others in our profession very often like this, and it's such a great format. And thank you so much for putting all this together, Jeanette.
Yeah, thank you. Thank you for presenting, and thank you, Alice, for your questions. And what's even really more fun is when the audience is able to chime in with their actual voices too, and sometimes video too. So that's a treat too. And we might just do that again tonight. We'll see. Let's get through these questions. We did that. Okay, Linda asked, we should not be wearing compression garments while doing manual lymphatic drainage, correct?
Correct. Unless you were feeling congested and you just kind of needed some abdominal work and you didn't have time to do the arm or the leg, I think it's best whatever area you are working on. Thank you for saying that in your question. I would do it over skin. That's going to be the best, so you're not getting that slippage like over clothes. But yeah, so if you could do the trunk, I would take the garment off before you would do your lymphatic sequencing. But you could do, if you had compression on the trunk, whether it's like a compression short or a capri, you could do the abdominal part. I just think it's easier and it's just more effective if you can get that skin stretch, that skin to skin, that tacking, that stretching. Is always going to be more ideal.
Yeah, definitely. I'll highlight that as well. To really perform effective manual lymphatic drainage, you have to take full advantage of the full stretch of the skin without doing it too excessively, of course. And so, but, you know, I was just thinking what a possible scenario, you know, this might be referring to. Like, let's just say, for example, it's Alice's left leg. And, you know, you can do manual lymphatic drainage, right, of the neck and of the abdomen, where the garment is not, you know, impeding your ability to stretch the skin. So you can certainly do that. And that's definitely something that you can consider. Like, let's just say you didn't have time to do the full sequence, but you had a little bit of time, just enough to do the preparatory work to make sure that the fluid knows to come up into the armpit. That's definitely an option. So
yeah, that's helping to create with that suction effect. So even if you aren't working on the leg, like you're still getting the benefit of doing that preparatory work, and so it will help with better fluid movement through that area.
Thank you. Let's see. Fenton asked, is there a list of different types of primary lymphedema, for example, Milroy's disease? I'll take that. Well, basically, there are different types of primary lymphedema. And yeah, I guess it is a little bit off topic, Fenton. And, you know, I think basically, you know, in case you're asking it as it relates to MLD sequenced, it may be the case where, depending on the type of primary lymphedema, that your sequence may change. Although, as you might have heard from Dr. Wei F. Chen the other day when he was speaking about primary lymphedema, you know, usually when there is a primary lymphedema diagnosis, there's more of a concern of there being global involvement of the lymphatic system. And so, you know, it will really depend on your particular presentation to determine what the best sequence is. And so, again, that's going to be something that is best, you know, discussed with your healthcare team. Vanessa asked, does fullness from abdominal lymphedema mimic the fullness from a gastroparesis?
I haven't heard that. It's more what my patients describe it more to me as. It's more of like a heavy, achy, like it just feels fuller, like it just not so much like paralyzing or anything like that. It's, you know, sometimes there can be some tingling, but it's more heavy, achy. It just is fullness is the main thing. Do you have anything else to add, Jeanette, with that?
Well, you know, I think, well, that's the reason why it's so important to be followed and to be diagnosed by the healthcare team, because, you know, in the abdominal region, you have all your a lot of vital organs, right? And it's possible to feel a fullness from many different things, right? And so it's always important to make sure that we totally understand what the swelling is coming from, because, you know, at the very least, you have to like rule out all of those major concerns. And if they've been ruled out, then we can then maybe proceed with a little bit more confidence, thinking that it is lymphedema of the abdomen. But you know, what I was thinking, I was looking for some paper to offer, and I think I can even do this whiteboard. Let me see if I can manage this. I'm going to share. Here we go. I'm going to share a whiteboard, and I'm going to draw something really quick. Okay, so let's do, first of all, black just to divide the body. Right, I'm going to try to do stick people so that it's a little bit more. Okay, but what's really interesting, right, because Holly, you were talking about, you know, the sagittal watersheds, and maybe I should do this a different color. You were talking about the watersheds, the sagittal watershed, which divides us from right to left, and the transverse watershed, which divides us from top to bottom. And what's so interesting is when you see some people who have abdominal swelling, and it's early onset abdominal swelling, or abdominal lymphedema, forgive me, allow me to be more precise with my communication. It presents like this. Let me choose purple here. So you'll see that basically you know, their outline on the top here above the watershed is perfectly flat and normal. You can see the rib cage, but then just below that, all of a sudden it pops out. So it's at that very line of the watershed, the transverse watershed, and usually it's symmetrical. It's like this, and all of a sudden it pops out. So it's like perfectly uninvolved from above the watershed. And then all of a sudden below that watershed, you'll see like a loss of definition. Like you can't, like if the rib cage is like long enough that it goes beyond the watershed, you'll see the rib cage perfectly. And then at the point of the floating ribs, you lose definition. So it's just really interesting. And this is kind of like really best observed by the clinical eye. But some people, if you are, you know, really aware of your body and you know like what normal anatomy looks like and everything, it's really just interesting. So this is like, you know, in the cases of people who have had pelvic lymph node dissection, whether it be from ovarian cancer or some other gynecological cancer or some prostate cancer, and that's where you'll see this presentation. So it's kind of interesting. That's what I wanted to offer. Okay, Stacy asked, headache, bladder infections, and facial tightness. Is there a connection to lymphedema?
I'm not a physician. You know, it's a little beyond my scope of practice. I would talk with your healthcare provider and just tell them the symptoms you're having, so then you could get that properly diagnosed.
Yeah, definitely. I would say the same. Thank you. Thank you for your question though, Stacy. Julia asked, please remind patients that OTs and LMTs are CLTs too. Yeah, I just wanted you to comment on that. Yeah. Do you definitely, you know, I think maybe because, you know, Holly is a physical therapist, I'm a physical therapist. If we by any chance did not give love to our fellow OTs and LMTs, please forgive us. But yes, indeed, whenever I refer to the team, and I think I'm pretty mindful of this, especially during our disclaimers, I always refer to our specialists as lymphedema specialists, which can be occupational therapists, physical therapists, and massage therapists. And in addition, it can also be like a nurse, it can also be a physician assistant, and it could be a doctor as well. However, that's very rare because you know, lymphedema therapy, as we all know, is very labor intensive and very time intensive. And so the structure of the day in order for us to see patients is usually most, you know, seen under OT, MT, PT. It's very rare that you'll see a doctor, nurse, or physician assistant doing it, but, you know, it's not unheard of. So thank you, Julia, for the reminder. I hope that if you are an OT, you felt the love. Number 2, Julia said, please tell patients that to find a qualified person for an exercise program, they can find a cancer exercise specialist from the Cancer Exercise Training Institute. Okay, well, that's a reminder or an offering from Julia. Oscar said, let's see here. Oscar said, thank you. It was a great presentation. And the question is, considering the time frame one has with a patient with lymphedema, usually 1 hour session, what would you say is the most important aspect of CDT? The breathing, the MLD, the bandaging? I'll let you go first.
Yeah, so that's a great question. I mean, we are, you know, constrained by time. And so generally when I'm seeing a patient for the first time, I don't have bandaging or garments or anything to offer them. I'm, you know, showing them different options and giving them the pros and cons of different types of compression if needed. I find that, you know, I really want them to understand what's going on. So I give a ton of education. I'm teaching them about what's going on with them so they have a better understanding. I'm teaching them about, you know, basic skincare education. You know, just giving lots and lots of education. I then teach the diaphragmatic breathing. If that's the one exercise that a patient's willing to start with, if they're like, oh, 6 is too many, or that looks overwhelming, I'll just have them start with the deep breathing, because it's so effective and it stimulates so many different areas of the abdomen, and we can get different parts of the trunk and limbs that are starting to feed into that system. So I usually have them get started with things that they can get started on right away with me. So the lymphatic exercises if possible, for sure diaphragmatic breathing, and lots of education. And then I can order the different compression they need, and then I start incorporating that, and then I just kind of build it up. It's really hard to get everything in all at once, but that's how I find it to be most effective, and the patients are able to then get on board with what I'm asking them to do.
Yeah, thank you, Holly. And I'd like to offer that, of course, CDT, complete complex decongestive therapy, it has the 4 components, right? And the 4 components are meticulous skincare, compression, which includes compression bandaging, compression garments, manual lymphatic drainage, and exercise. And I did notice that in your list, Oscar, you did not list exercise. Now, I totally understand why. Because I think that the trap that many clinicians, many therapists fall into is that you have an hour, and an hour goes by so fast, right? And you figure you need at least 35 minutes for a good manual lymphatic drainage session, and then you have to worry about the bandaging. And so what often gets left behind, or maybe just not as much emphasis, is exercise and the meticulous skincare, right? Unless that was taken care of earlier on. But I'd argue that everything is just as important, because I think that the thinking that usually happens is that people think, well, I can just tell the patient to exercise and they'll exercise. So it's but they need our manual skills here in the clinic. So then I'll do that, and then I'll say, Mr. So-and-so, please just make sure that you ride your bike, make sure that you walk, make sure that you exercise, right? Or whatever it might be. But I think that really we need to make sure that we emphasize everything equally. And the way that I have tried to navigate this is as follows. Let's just say, for example, you have a patient who comes in and they have both legs involved, or and you're already thinking manual lymphatic drainage for both, that's already going to take up the entire time. Bandaging, that's going to take up the entire time. So some ways that you can manage this, the general is that we know that when we do an effective bandaging, it can last for more than a day, right? It can even last over an entire weekend, especially if you use the thicker gray foam. And so what we can sometimes do is, when they're coming in for intensive therapy, a patient, or the patient, can basically be bandaged, and that stays on for 2 times, so for 2 days. So you come in, let's say on Monday, the therapist does the bandaging for you, that stays on. That it might have taken the entire time that first day on that Monday to have applied. That stays on all day Tuesday, and Tuesday, the entire time, 45 minutes is spent on manual lymphatic drainage, and then a little bit on exercise and skincare. And then the next day, we redo the bandaging. And that's definitely something to consider, right? To basically break up the intensive therapy that way. Definitely, various ways to get creative to make the best use of time. But I think, it's just important to emphasize everything, especially also self-care, right? The whole inspiration for this month is self-care. And I'll share with you a very big mistake that I made with one of my patients, which is, he had elephantiasis of his lower leg. And I share the story a lot, so forgive me if you've heard it before, but he had elephantiasis of his leg. I saw him for 6 months, intensive therapy, 6 months, every single day. And I did all the work. And then on the last day, I gave him his garment. I said, good luck. And I showed him how to do the self-bandaging that day. I showed him how to do self-MLD that day. I gave him his garment. I showed him how to put it on that day. And I said, good luck. And basically, you can kind of guess what happened. pretty much within a week or two, he came back and he was just as big as when we first started. And so, you know, I can't highlight enough the importance of learning how to do things yourself. You know, in Europe, as you might have heard the other day with Dr. Ricci, you know, they have a different model of healthcare there where like manual lymphatic drainage is performed for the patient on an ongoing basis. That's not the case here in the US. And, you know, you can't rely on that because it's just not, you know, going to be covered. And so it's very important that every person feels empowered to take control of their own lymphedema and do everything that's necessary. So that's the thing with that. Okay, let's see. It's already 6:15. We need to give some love for LNR to LNR. Let's just see really quickly. I think that we might just need to like do a quick review of like the direction, because Alice was wondering, like, you know, she gets the, you know, going up like when the abdomen is involved, but she doesn't understand when do you go like from side to side, to the right or to the left. Can you just maybe say that really quickly?
So let's say that the swelling was just in the lower abdominal area. And I don't know if my camera is reversed or not, but I'm on my left side. And so then when I am doing, you know, if it's just involved over here, I have the option to use that inguinal, the interinguinal anastomosis to bring fluid to my other side. So again, I think if there's like a big red X in the area I don't want fluid to go, it always needs to go away. And it can just cross one of those lines that Jeanette just redrew for us, that vertical line or the horizontal one. And so we can bring it up, but we can also bring it over as long as there's no involvement on that other pelvic or abdominal side below that watershed, that line there. So we can bring the fluid across. Well, again, I like to stimulate it first. Again, this is a little silly, but I tell my patients, imagine these lymph nodes are really needing help. And so they're yelling, help, help, to nearby nodes. And then the nodes that are in those areas that are closest to them, they're like, yeah, we can help out. So they're giving them that message, and then send the fluid. And then we send the fluid over. And again, you can do one or both hands. I like the two because it gets more area involvement. So it's getting more of the skin stretch, so more of those lymphatic capillaries, those initial lymphatic vessels can open to get the fluid into the system so it can get processed.
Thank you so much, Holly. So we have like a whole bunch more questions, but we won't have time for that. But fear not, because our amazing project manager, Christy Blair, will basically has been keeping track of all of our questions. And, you know, what we have been doing is basically just been prioritizing getting the video links up on to, you know, the website. But at some point we're going to, you know, edit everything where we, you know, we're going to look at the talks again, and some of the speakers mentioned links or specific references. And if they gave it to us, we're going to add that separately. We're just going to have to organize it a little bit. So even like, for example, Holly, she's going to share her slides and her diagrams. We'll add that, but we're going to do that later, you know, slowly as we go through everything. But so we'll answer your questions at some point in time. And Holly, thank you so much again for your talk today. And what I'd like to do now is actually just do a very quick demonstration of abdominal bandaging. It's pretty simple in terms of it not having that many steps, but I think a quick demonstration is always helpful. So Holly, we'll see you when we see you. Thank you again.
Thank you so much. I appreciate you all being here. Thank you so much.
Thank you. All right, so let me see here. I am going to just do this. Okay. All right, so what I'm going to be using is what we're giving away today. This is Comprex 2. So it basically has like an open cell foam, which is easily collapsible. And as you can see, it has the channeling that, you know, comes from the seams. And so this will just help to basically, you know, break up any fibrosis that might be there, and also to help direct the fluid. So I'm going to bring this up a little bit. So I'm just going to put it right over the abdomen. And then over here, I have this bandage, which is a short stretch bandage. And we've already discussed the properties of a short stretch bandage. This one is a 12 centimeter width bandage, and it is also a 10-meter length bandage. So it's basically twice as long as your typical bandage. So it's the extra long, right? And obviously for the abdomen, you'll need that, especially if there is, you know, a larger amount of swelling in the abdomen. Right. And so again, this is only be done if your therapist showed you how to do it. But, you know, just to give you a sense of what it might look like in case it's been a long time or whatever, for those of you who are curious about what it's like to have lymphedema of the abdomen. So basically, you're going to just basically have like a nice long stretch here across the front of the abdomen. And you want to make sure that the lead, in other words, how far back this hand goes, which is holding the end, is able to go pretty far back, because unless you're very flexible and you're able to reach your one hand all the way around the back to the other side, you're going to need it so that this has a long lead. And then basically this hand goes pretty far in the back here, getting rid of those wrinkles, covering all the foam from the edge. And then I cover in the back. Let me see if I can just show you what's going on back here. You want to cover that ending, right? So I want to make sure that this edge over here is also covered, because if you have any corners sticking out, it's very easy for that to become undone. I'm going to show you the front view again. And you just basically continue until you have everything covered. I'm going to add one more layer over here, because if you're going to do anything, you want to have a little bit more compression on the bottom to lift up the abdomen a little bit, right? So I'm going to do one more time over here on the bottom, stretching a little bit, and then I'm going to work my way up. Overlapping a good percentage, it's usually 50%. Making it nice and even. And honestly, this like feels so good. Compression, I think, does the body good in general. Stole that from milk. One more time up here to cover all of my foam. And of course, you find a nice, safe way to hold this in place, which is usually tape for this area, right? You don't use those metal clips that these bandages come with. So it's pretty like, you know, compressed in the front, the back as well. Let me get rid of my mistakes back here. I like to flatten it all out. And there you go. Okay. All right, so that is abdominal bandaging. Pretty easy to do in the sense that it's just 2 steps, not even. It's like you just have to place the foam on and then you add the short stretch bandaging, right? But it's a little bit difficult to execute if your flexibility is not there. And if you have a larger abdomen to begin with, where you have to like really worry about lifting it and putting in place. But, you know, this is just a quick demonstration just so you can get a sense of what it's like. And now, with that, I am going to introduce LNR USA, Lindsay Ryback, who is the product manager, excuse me, I was thinking of a Christy Blair, product manager of LNR USA. So Lindsay, come on onto the scene whenever you're ready. And LNR USA is a Magenta sponsor of the National Lymphedema Network, which means that they really support us in a big way. And we're so grateful for their support. And are there any questions with the bandaging demonstration? Well,
doesn't look like any questions right now, Jeanette.
All right. Well, you know, I've been in communication with Lindsay, and there she is. All right. So Lindsay, again, product manager, right, of LNR USA? Okay, correct. Excellent. Thank you. I mean, I say it so often, I should have it, you know, known by heart, but my memory is just not there. So thank you so much for your support. Thank you for your presentation. The floor is all yours.
Awesome. Thank you. Thank you to Holly as well for a wonderful presentation. I learned a lot as well. So that was really great for me to be able to sit in on. So thank you guys for having us here today. LNR is really proud to be a Magenta sponsor of the NLN. I figured I'd show you guys. I've got my butterfly necklace on. so I got that covered. Before I get started, I just wanted to quick say thank you. We've been a part of a lot of these sessions with the National Lymphedema Network this month. And I think the work that's been done to really be able to help educate patients has been so wonderful. And it's been great to see all of those connections built. Right before this, I actually did a quick Google search and I was like, like what are some things that the butterfly symbol like symbolizes? And so I was looking at it in a little bit of a detail, and things that came up were transformation, creativity, endless possibilities, building connections. And those were some of the things that I was reading it and I'm like, I feel like this is really what the NLN is doing to be able to bring us all together, to connect us and really transform our knowledge and really help understand lymphedema and its treatment more and more every day. So just wanted to quick say thank you on that. And just something that I just quickly typed up right before this. So we're going to talk about some solutions that LNR offers to be able to support patients with abdominal lymphedema. So Jeanette showed a couple of those. So when you look at that complete decongestive therapy, we've got all of these different components that we've been talking about. We've got manual lymphatic drainage, bandaging, you've got garments and wraps, skin care, nail care, diet, exercise, and LNR really likes to make sure that we're helping cover a lot of those with our product solutions that we offer. So we're going to go into that in a little bit more in depth, but just wanted to kind of point out that we're really looking at the products that we offer to make sure that they really help with you in that long-term care with your disease state. So of course, we're going to talk about that abdominal portion. So today we're going to talk about skin protection. So I think that's a really key piece, making sure that you have that layer before you put your bandages in place. We're going to talk about some foam type products like the Comprex 2 that we'll be raffling off today, as well as the Swell Spot, the Rosedal K, that short stretch bandage that Jeanette was using to wrap around her abdomen. And then we'll talk about Lancolast as well. So one of the great things about our bandaging line is it's extremely extensive. And one of the awesome things for abdominal lymphedema is that we have this TG tubular that comes in really large sizes, the K1, K2. A lot of stockinette out there is really just made for the arms and for the legs. And so LNR wanted to be able to offer some larger sizes so that you can actually, apply more than the stockinette just on your limbs. And so this is a really great option that not everyone knows about. So if you're looking for skin protection, have that stockinette option. We've got what's called K1 and K2 in terms of the sizing under the TG tubular. It's a really lightweight, breathable stockinette that can go right up against the skin. And it's going to be really comfortable. And it also has a really nice stretch to it. So you can get it over, your head or step into it, whatever's the best path. But this is a really great option and solution for abdominal lymphedema. So something to keep in mind. We also have the Comprex 2, as Jeanette said. So this is going to be an open cell foam. So it's going to not be as dense. It's going to be more like a gray foam if you've used that in your therapy. But it's going to have these awesome channels that are sewn in. And so when you were talking through that manual lymphatic drainage and how that fluid is being directed, what's great about this is you can position this Comprex 2 in the direction that you want to direct that fluid to. And so you'll be able to apply that, and you can use your short stretch bandaging over top of it. And it's just a really nice, soft, skin-friendly piece of material that has foam sewn into it and these great channeling options. You can also use it, like Jeanette showed, under bandaging, but you could also maybe have a compression shirt, or maybe if it's going to be lower, you can just have some biker shorts that maybe go up a little bit higher to be able to cover it, and that's another solution there. We also have a Lancolast. Sometimes people are very sensitive, and so maybe a short stretch is maybe a little bit too aggressive in certain areas. And so this is a medium stretch, so it's not a long stretch bandage, but this is potentially an option you could talk about with your clinician if you're looking for something a little bit softer. It's medium stretch, so it's between your long stretch and your short stretch, but it's going to have a really soft, skin-friendly feel to it. So it's just going to be a little bit better if you have a little bit more of that sensitivity to the materials. And of course, Rosedel K, I think one of the great things that you get with this Rosedel K line is you get that double length as well. So especially for the abdomen, you're going to need less bandages to make your way around if you get that double length. So definitely keep that in mind, that there is 5-meter length and there's 10-meter length. So when you're looking at abdominal, definitely look towards that 10 meter so that you can work your way around without needing to tape and get a new bandage to put in place. So swell spots, so we talk about foam technology, breaking up fibrosis to be able to soften that skin, scar tissue, things like that that are left behind. And you want to be able to break that down, get that so the fluid can get out of those congested areas. And so swell spots are great because they're nice because you can throw them in the washing machine and dryer. You can get them in custom. This is a great pad. It's a much larger pad that you can use on your abdomen. So this is a really nice solution to be able to get that foam to press into your tissue, to be able to give it that little bit of a massage underneath the bandaging or underneath that compression short or shirt that you're wearing, to be able to just break that up underneath the bandages. So it has all these little chip foam pieces inside that can be used. So this is our Tic Tac pad. So this is a great option for the abdomen. So the Tribute Nightline is something that we're really known for most in the market because it's an incredible nighttime garment that is 100% customized to a specific patient. And so what's great about this is it's not just your arms and legs, it's everything from your head down to your toe. It's used for evening, night, but if you think of yourself just relaxing, watching Netflix on a Saturday, which might be what I'm going to do tomorrow, you can have your coffee out and you can be able to just relax and, you know, be in this garment and not have to put on your daytime garment quite yet. It's kind of like hanging out in your comfy sweatpants or your comfy sweatshirt. So we've got these measurement forms that really take down all of that detail that you're going to want to make sure that it's going to fit properly. So as Jeanette was showing in that diagram, you can see how it went straight, and then there's some different shaping underneath there, and we can accommodate all of that different shaping. So it's really the perfect fit for those that are wearing this product because it's truly made for you. You can add various different things to make it customized to fit correctly, but it's a great solution to be able to have that. So just kind of like to show the order form because it's really tailored so that we can make sure that we're collecting all of that detail to make the right garment. And here's the lower leg, but that also includes part of the torso as well. So something fun to kind of see what that input side looks like that helps us create that garment handmade in Milwaukee, Wisconsin. So you can see here we've got some different styles, and these are just some good examples of things that we can do. This is just a small breadth of what we do, but you can see there's a lot of options that can cover that abdominal area. You can see that there's ones that are more like a shirt, bodysuit. You can see you've got some shorts, you've got pants, you've got vests. You can see that little vest has that adjustability right there at the top to just help make sure that things are positioning correctly. And then you can see this great abdominal binder right here, which is awesome that you'll be able to just be able to get that on. And so you can see whatever style works best for you. We can work with you, we can work with your therapist, your fitter, to be able to help you get that right contoured fit and make sure that it has any modifications that you may need to make it really easy to put on. So we talked about the manual lymphatic drainage process, and that's something that's great that we offer. We have the different channeling options so that you can get that channeling to direct the way that you want that fluid to move. And so that's where your clinician will look at this, look at what they're doing with their treatment with you, and be able to select that so that we're really directing that fluid. So if you remember in that Comprex 2, you can see that channeling foam. It's going to have that same principles here in this type of self-management solution. And of course, this is on the leg, but you're going to get that same impression in the abdomen. So you want that foam to press in from that Tribute night garment. You want us to be doing that massage while you're resting. So it's going to do all that hard work. So let the foam do the work so you can rest. And so that's going to get in there. It's going to nestle in. It's going to really just help break down, address it But also, one thing to keep in mind is sometimes you may say, maybe I don't have fibrosis. But if you remember back to the CDT process, skin health is such an important component. And maintaining that success really comes from the different lotions or things that you're going to use like that, but also from the foam and helping keep that skin healthy. So it's not just to get something to go away, it's keep it away. One thing that's been really great for a lot of styles, but particularly the abdominal styles, is having the profile height option. So we've got the original profile, which we've had for many years, but now we have the low profile option as well. It's the same amount of foam, just smaller foam pieces and more channels sewn into the garment. It's the same exact price if you choose one versus the other. It's going to have the same clinical benefit. But the nice thing is it's going to lay a little bit flatter. So it's maybe going to feel a little less thick and pillowy on your abdomen, which is sometimes nice to have something a little bit sleeker to be able to have on around that area. So really great option if you're looking at this, to look at that low profile option. It's a simple checkbox on the order form. And if you're worried about getting hot at night, don't worry about it. We do have Cool Core technology, which is built into the fibers to rapidly wick away that sweat and moisture to just help keep you cool and comfortable while you're wearing that garment. And you can see here, you can get it in a lot of fun different colors as well. And something that's great for the abdominal binder is to have some sort of a modification, whether that's maybe a zipper at the front, so you kind of just can put it on like a coat, and then you can zipper that over top. You can have adjustable straps that go across that are going to be Velcro, so you can fasten those to get that right contoured fit. But your therapist and our design center and you can really work together to figure out what that best solution is to have a really proper fit, to be able to get that conforming really nicely, but also make it really easy for you to put it on. So something to keep in mind, we do have a great warranty that comes with this product. So in the first 45 days, if it doesn't fit perfectly, you can work with your therapist, we can take it back, we can make any adjustments free of charge. And of course, we want you to reduce. So if you do reduce from having this compliance and using this type of a product in conjunction to what you're doing during the day, we will take that garment in free of charge. So it's kind of like getting a new garment in that 1-year warranty of the life of the garment. So we have our contact information here. Feel free to call us if you have any questions, email us. I put our website on there. I also put links, or I also put descriptions for our Facebook, YouTube, and Instagram pages. So like us, follow us. We have a lot of good information that we can be able to share with you so that you guys can really stay on top of what's new and what's available out there for you. I think it's so cool to have patients so involved in their therapy, and I think that that's something that NLN has really brought, and we definitely want to continue that with the type of information that we provide on those channels.
Thank you, Lindsay. And while you're at it, you can also like and follow the NLN too. Okay.
I agree.
So there are just 2 questions, Lindsay. The first is from Preeti, which is actually for me. How many layers of foam are used? And I think that came in like for the bandaging. And so really, you only need 1. However, to give, when I'm using the Comprex 2, I use 2 just to give it some structural integrity. Otherwise, it's very easy for it to kind of collapse, onto itself. So I use 2 just to give it some oomph. And it doesn't really, make it any more uncomfortable because again, it's the open cell foam. And then this one's for you, Lindsay. Does the Lancolas come in different widths? He actually said sizes, like for example, small to extra large, but I assume he meant widths.
Yes, we do have various widths. We don't have, we only have 1 length. So like the Rosettelle K, you got that 5-meter length and you've got that 10-meter length and a lot of different width sizes. This one will have those different width sizes, but it's just going to be in the 1 length for the Lancolas.
Thank you so much, Lindsay. Thank you so much for your talk, for your support, and for your generosity of giving out a Comprex 2 sheet, which is, like, I understand, super duper expensive. So I'm going to welcome our continuing education manager, Jennifer Williams, to come on, and there she is. And Jennifer, if you can just share your computer sound, share your screen to see who our lucky winner is today. Oh, let me stop sharing. Yeah, there we go. Okay.
All right, here we go.
Thank you. No way, Vanessa, like it's the third time in a row. Okay, well, Vanessa, congratulations. All right, well, so Lindsay, what should we do? Should we connect Vanessa to you directly? Actually, she probably already has your your info from one of like the last two nights, but should Christy connect you and Vanessa, or should we give Vanessa your email address directly?
I think either way works well for me as long as she has my email. So whether you connect or just send my information, whatever is best works for me.
Okay, well, in that case, then Christy Blair, if you can just quickly put your email. Oh no, actually we turned off the chat because it was for privacy reasons. So Vanessa, if you can please take down this email address, which you might have received already. It's christy.blair@lymphnet.org. If anything, you can just go ahead and email me. Like I have the information. My email address is is available on the webinar information. So you can do that. Otherwise, it's Christy, Kristy, and Blair is AIR. All right. Lindsay, thank you so much again. Thank you to Holly, who is still on with us, for your amazing talk. Thank you to my amazing team. And I really want to give a special shout out to my team because they are on here with us every night, working behind the scenes, just making sure that they manage the chat and the Q&A and get connected with the winners and do the wheel and support me. And it's just so amazing. They are absolutely phenomenal. And so thank you to my entire team. And again, very big thanks to all of you. It is Friday. It's a beautiful day here in New York. It's 81 degrees, and you could have chosen to do anything else, but you decided to spend it here with us. And we're so grateful for your engagement and for your time and your attention. So with that, good night from New York, and hopefully we'll see you tomorrow. Or actually, just to let you know, it won't be me tomorrow because tomorrow is Passover. My family does celebrate Passover. So Erin will be your presenter and MC tomorrow. And the rest of the team will also be continuing with the behind the scenes. And again, this is my daughter who just can't help herself. She wants a little bit of love and attention. She's going to be famous one day, I'm sure. And there's Lindsay and there's Brianna. Brianna's my 8-year-old. I also have a 13-year-old. Okay, good night.